Is it possible that Big Pharma lie to doctors in order to get them to prescribe medications that are not appropriate for their patients? Of course it bloody well is. Let me show you how it happens. Hello there, you 4.9 million awakening wonders. Welcome to the journey of light. Come out of the darkness. We don't need to be afraid anymore. We can communicate openly. We've got nothing to be scared of. Hey, I did a fantastic episode of my podcast, Under the Skin, with Dr. John Abramson. He's been on Rogan as well. He's a great doctor and he's a consultant when they have legal trials against big pharma companies, you know, for legit actions that they have undertaken and have subsequently been sued for and stuff. In this bit of the conversation, he talks about, like, how can doctors who dedicate their lives to helping other people, who swear an oath, who are good people, who live to serve and help others, how do they find themselves in a position of prescribing medications that are no bloody good for them? In my conversation with John Abramson, it becomes clear that doctors are overworked and overstressed and get a lot of their information from big pharma, who obviously give those doctors information that's beneficial to them. In this conversation, he explains how the opioid crisis, one of the biggest disgraces the big pharma industry has ever known, came about because they literally lied and said, this drug ain't that addictive, you can prescribe it to all sorts of people, they'll be right as rain, even though they knew it was super addictive. Stay to the end of this conversation, you're going to learn from this.
With the is the opioid crisis the most glaring example of mendacity in the pharmaceutical industry? Is it particularly extreme? Is it Sackler family, the Sackler family, and the deliberate promotion of dangerously addictive opioids and synthesized opioids? Does that stand alone as a terrible example of malfeasance in the industry, or is it pretty...
No, it does not. They happen to have a more dangerous drug, but the way they marketed that drug was just routine journeyman BS about convincing doctors to prescribe a more powerful drug that they had been comfortable prescribing before. So they tried to convince doctors that this drug is not addictive and it's not abusable, and it's so safe that it can be used for routine pain. We used to just use chronic opioids for cancer pain. And in fact, it was Purdue that made a long-acting cancer pain drug based on morphine, and their patent ran out. And the geniuses there came up with the idea of doing this with oxycodone, making the argument that oxycodone is less potent than morphine, so it's less addictive. In fact, it's much more potent than morphine. The whole thing is BS. So they are unique only in the mendacity. Their mendacity to impose the journeyman branding tactics on a population that was subject to it because of the socioeconomic conditions in the United States, and they found a brilliant market to exploit. So their exceptionalism is in their marketing, but the whole project was no more evil. You could substitute many other drugs for opioids, and you'd see the same kind of marketing excess. The one thing that they did that I thought was particularly deserves a badge of dishonor is they sold OxyContin as a 12-hour pain relief. And they could charge more for it, and the insurance companies paid for it, and they made up this story about you get less peaks and valleys, and when you have more even opioid effect, you require less drugs. They knew that it didn't last 12 hours. They had done a study early on, before the drug was ever approved, in women in Puerto Rico who had gynecological surgery. And they knew from that study that a third of the people couldn't last 8 hours, and more than half of them couldn't last 12 hours with the pain relief provided by OxyContin. They knew that. And what they did is they told the doctors that if your patients are having breakthrough pain before 12 hours, it means they're not on a high enough dose. And what they did is they cranked up the dose to addictive levels. And that takes a very special kind of person to come up with that.
Yeah, that's a pretty unethical model. But I can see how it's sort of derived from, again, the maximization of profit, which is not unique to the pharmaceutical industry. But I suppose what is unique to the pharmaceutical industry and is epitomized in the Hippocratic Oath is the idea that this is an endeavor pursued in order to benefit human beings, to take care of one another. Is there an argument that pharmacology and medicine ought be exempted entirely from profit-driven models because there is something inherently wrong about using people's pain and suffering to derive profit?
I think that argument has integrity. It makes perfect sense. I don't think it's politically feasible, but as a thought experiment, it works very well. I think the more feasible approach is to just acknowledge that when you have an unregulated market, when the integrity of the knowledge is unregulated and it's very complex, that the commercialism will exploit and distort the recommendations for optimizing the health of the population. That's just a fact. It has to happen. If you play that game out 1,000,000 times, it's going to come out the same way 1,000,000 times. So let's just accept that and say that we need some referees here. Do you know the name Milton Friedman, the conservative economist? Yes. So yeah, he's sort of an icon in the United States. And in 1962, he wrote a very radical book called Capitalism and Freedom. And he posited that there's only 3 legitimate functions of government: to maintain law and order, to enforce private contracts, and to ensure that markets work. And other than that, government ought to get out of the way and let the market, let people decide by their participation in the market what their highest quality of life will be. Well, if Milton Friedman were resurrected now, we'd see that the pharmaceutical companies are not subject to law and order, to the dictates of law and order, that they've been fined $38 billion over the last 20 years or so, and that nobody's gone to jail and no drug companies have gone out of business because they've been fined, and that the so-called law and order is a sham and there's slaps on the hand and everyone goes about their business making money, that private contracts are not enforced because the drug companies own the data. And there's such asymmetry of information that the people who are buying the drug or paying for the drug have no idea what they're paying for, and that the market doesn't work. We've got a complex market where most of the drugs are paid for by insurance, and the marketing has a certain effect. So if we just brought back Milton Friedman and had government do the 3 things that he recommended, vis-a-vis the pharmaceutical industry, we would get a long way towards optimizing the social benefit of medicines.
Did you enjoy that? Let me know what you thought of it in the comments below. What does this make you think about Big Pharma? What kind of regulations should there be? Would you like controls introduced for drug prices if you're over there in the United States of America? Do you know someone who is affected by the opioid crisis? Why is this stuff still happening? Why can't we regulate the behavior of these great behemoths that stride across our globe like titans? What's going on? If you enjoyed the conversation, maybe you'll consider subscribing to Luminary, the podcast network that houses my fantastic podcast Under the Skin. It's like a university. I speak to fantastic people on issues you care about, as well as doing a guided meditation every week, so you're in a fit state to deal with reality. If you can afford it, subscribe to it. If not, keep enjoying the free content that I will provide for you, as long as I bloody well can. Sign up to my mailing list so I can stay in direct contact with you. And if you're in the UK, March, April, May, I'm doing live shows. I'm in the run of doing them now. They're fantastic fun. If you're in Bristol, Plymouth, Glasgow, Newcastle, all these places, I've got fantastic shows and we're having real connections. Real deep understanding is emerging. If you enjoyed this video, have a look at this cheeky little guy. Maybe do a little bit of meditation. This is a pretty good thing for you to try out. Anyway, I love you. The awakening is underfoot and I need you to participate in it with me. Stay free.